I want to talk about cholesterol today, and this is a nutrient that's been beat up, hammered on, vilified for the last 35 years as this evil thing that we must control or it's going to cause a heart attack and kill us. And despite all the evidence to the contrary and the research that shows that it only affects less than 1% of the population, I still have people coming in every week taking cholesterol medication, the statins, and to lower that cholesterol. And so I want to talk today about the benefits of cholesterol because they're huge. And the first one is your brain. 60% of your brain is made from cholesterol. So if we're taking medications to lower the primary building block for your brain, do you think that might be part of the influence of the huge rise in Alzheimer's and dementia in the last 30 years? It's also a primary building block for hormones, especially the sex hormones, testosterone, estrogen, and progesterone, which are also been on a decline in the last 35 years. The last one is your cells. Every cell in your body is made of cholesterol, so it is a major building block for some very important stuff for our body. So here's why it gets the bad rap, okay? So this is a blood vessel. We test for inflammation in your blood in our clinic, and we use a test called the erythrocyte sedimentation rate. There's some other tests we do, the CPR as well. You can test homocysteine. There's a lot of different tests, probably 5 or 6, that test inflammation in the blood. If you got inflammation in the blood, it's going to cause damage to the inside walls of your arteries. When that damage happens, it causes tears. And our body uses cholesterol to patch up the tears like a putty. If you have a hole in your wall and you putty it up, so our body uses cholesterol. So if there's a tear here in this part of the artery wall, there goes a patch of cholesterol. If the inflammation is allowed to continue, then we get another patch and another patch. And the patches just keep piling on each other until eventually your artery's blocked. And so cholesterol gets blamed for this, but cholesterol is trying to do a good thing by patching up the damage. The problem is the inflammation. So if we eliminate the inflammation, we eliminate the problem.